Hello guys, and welcome to this video to talk about the dental terminology that you guys need to know, even to talk about clinical cases with your colleagues, and to describe lesions following the anatomical landmarks, describing the location of the anatomical landmarks, and at the end let's review also the tooth surfaces and the parts of the tooth, and also the tooth classifications, the numbers, all right? Because we have two main classifications and they are different. So let's start by this terminology here using those two top left corner images. You guys are realizing that I have an asterisk here, and the asterisk is for us to describe the location in relation to the anatomical landmarks. So here, for example, if I need to describe the location of this asterisk, I can say that this asterisk is anterior to the mandible, all right, or anterior to the lower incisors, okay? Why I can say that? Because here we have a lateral view of the skull, and if we have a lateral view of the skull, or the sagittal plane, of course, this would be anterior and this would be posterior, okay? So this is more posterior than this, so the left side of the image is anterior. We also have the relationship of superior and inferior, right? So the mental foramen is inferior to the level of the apices of the premolars. Okay, this could be a lesion, so I could even describe the lesion following the same system. What is the distal limit of the lesion? Okay, so the lesion is distal to the second molar, for example. The lesion is buccal to the furcation of the molar, so you can also describe using those terminologies. And probably you guys realize that in my videos I always say buccal to this, anterior to that, lingual to this, okay, medial to that, and that's why we need to review those concepts. Now on this other image here, we have of course a more frontal view, right, of the skull. And then here we have the relationship between medial and lateral, okay? So this is the lateral medial extension of this image, of this skull, all right? So if my asterisk is here, then my asterisk is lateral to the mandibular ramus. So closer to the center, closer to the sagittal midline, we say medial, all right? So the nasopalatine canal is medial in relation to the central incisors because it's closer to the sagittal midline. It's actually along with the sagittal midline. This other asterisk here, for example, is in the roof of the maxillary sinus, which is the floor of the orbit, okay? So this is the superior limit of the maxillary sinus, or the inferior limit of the orbit. You can always describe medial lateral extensions of lesions as well. So these other asterisks, the red asterisk here, we have the impacted third molar, right? So it's impacted because it's superior to the level of the other molars, okay? And of course, it's in the bone. So how I can describe the location of this? If I want to compare this location with the location of the zygomatic bone, for example, then I can say that this third molar is inferior and medial in relation to the zygomatic bone, okay? Because it's below the level, or the vertical level of the zygomatic bone, and of course it's closer to the sagittal midline, all right? So don't forget about this. So very good. Let's also review some concepts of terminology. This is the alveolar crest, the bone, okay? So probably you guys already know this from my previous videos. And this bone here is the bone of the alveolar ridge, okay? Don't forget that the outer layer, including the crest, the surface, is cortical bone. And inside you have the trabecular bone, okay? So the two types of bone that you have. On the other hand, this image here is showing to you the dental arch, okay? Not exactly the alveolar ridge. So this is the dental arch, okay? So it's the inferior, the mandibular dental arch, all right? And then we divide the teeth into anterior and posterior, as you always see when I'm doing this in my videos. Anterior teeth is between canine to canine, all right? So canine and incisors, lateral incisor and central incisors, are anterior teeth. Posterior teeth, very simple, premolars and molars, that's it, all right? So those would be the posterior teeth, okay? Let's see, we also have the surfaces, right, of the crown. So this would be the buccal surface of a crown. What are the other surfaces? So of course, this is buccal, this is the occlusal surface, okay? So this is an upper premolar. This is the lingual surface, all right? And then we have mesial and distal surfaces. the interproximal surfaces. So what are the interproximal surfaces? Those in between the teeth. And then if this was a crown, of course, just also to let you know that the buccal and lingual surfaces are also called smooth surfaces, okay? But if this is a crown, then this part of the crown, so the parts that will be cemented on the preparation, is called intaglio surface, okay? So this would be the coupling interface, all right, of the crown, which would be cemented on the preparation. And speaking of preparation, let me give you a zoom on this preparation here. All right, so the preparation have also the terminology, okay, for the preparation. So this would be the finish lines, all right, or margin, okay, so margin or finish line. Then you'd have the axial walls of the preparation following the axis of the tooth, and then the surface, okay, so the occlusal surface of the preparation, all right? So if you say like this, you can, of course, describe properly, your preparation. So, of course, you could say also the lines. So this would be the line of the buccal cusps, all right? And this is the buccal cusp, this is the lingual cusp, right? And then in the middle of the occlusal surface, you can have grooves, okay, if they are elevated areas. Then you can also have fovea if they are areas decreased in volume, okay? So, and you can also have fissures. So this would be the fissures of the molar, right? So you have the fissures, you have the grooves, and of course, the lateral aspect of the occlusal surface is the ridge, okay? So the ridge of this molar, okay? So the distal ridge, and of course, the mesial ridge of the occlusal surface. So those are the parts of the occlusal surface, very important, because you need to describe the location of the caries, for example. So the caries is located in the fissure of the of this molar, and we are going to talk about the tooth numbers very soon. The caries, if the caries is here on my mouse cursor, then the caries is in the buccal surface, but then we need to explain thirds, all right? How to do that? You can divide basically any anatomical structure in thirds, all right? So this would be the occlusal third of the buccal surface. Then we have the middle third, all right? And then the cervical third. Okay, so this would be the cervical third. Why cervical third? Because it's the third closer to the CEJ. It doesn't matter if it's upper tooth or lower tooth. Okay, so this is very important. This would be the area closer to the CEJ, all right? And then you would have the gingival tissue. So just for us to review the gingival tissue, it's not showing here, of course, because those are CBCT images. We would have the papilla, of course, right? So the papilla between the teeth, and then very close to the CEJ, this gingival tissue, we start to have our keratinized tissue area, and this layer very close to the CEJ would be called attached gingiva, all right? So you'd have the attached gingiva, and then you'd have, of course, the marginal gingiva, and then the free gingiva, the mucogingival line. And after this mucogingival line, so closer to the buccal sulcus, where we do our infiltration, then you'd have the oral mucosa, okay? So that's the oral mucosa, which is darker, it's not keratinized, so it's completely different. You can also divide any surfaces in thirds. So this would be, for example, for the occlusal surface, this would be the buccal third of the occlusal surface, this would be the middle third of the occlusal surface, and this would be the lingual or palatal third of the buccal surface, okay? So if I have caries here, then my caries is limited to the middle third of the occlusal surface of this tooth. So that's how we can use to describe the location of the anatomical structures. Even in the bone, you can do that. So you can divide into inferior third of the mandible or the alveolar bone, middle third, and then superior third of the alveolar bone, which is the one closer to the alveolar crest. All right, so the alveolar crest, this cortical layer, which is the surface of the bone in both maxilla and mandible. All right, so the part closer of the bone closer to the CEJ of the tooth, for example. Those would be among the main terms for us to learn to describe anatomical structures, okay, and to learn dentistry and to study dentistry. You also have, for anterior teeth, instead of the buccal cusps, you have the incisal surface, right? So you have the incisal line, the incisal surface, because you don't have buccal or lingual cusps, right? So you have the incisal surface instead of an occlusal surface. And then you'd have the palatal surface of these incisors and the lingual surface of the lower incisors and lower canine, including the cingulum. Let's also talk about the tooth numbers now. And here we have two main classifications, all right? So the American classification, which is not the one I usually use in my videos, okay, is the one that starts with 1 on the upper right quadrant. Don't forget that you can always divide the dental arch into quadrants, all right? So this would be the upper right quadrant, the upper left quadrant, the lower left quadrant, and the lower right quadrant. Don't forget that it's just like we are seeing the person in front of us, the patient in front of us. So it's inverted in relation to our screen, right? So the side that you are seeing, the left side of your screen is the right side of the patient, right? As we are telling you right here, okay? So this would be number 1, then, which is the upper right third molar, okay? Then we start counting, then number 2, number 3, number 4, until we find number 16, so the upper left third molar, and then we go downwards in the same side. So this would be number 17, the lower left third molar, and we keep counting number 18, number 19, until we find the number 32, which is the lower right third molar, all right? So this would be the classification of the, like the American classification, okay? So this classification would be known as American. Well, this is not the classification that I use most in my videos. So the classification that I use is the other classification, which is the classification of quadrants. So each quadrant starts with a number. So the upper right quadrant has the number 1, this is number 2, the lower left number 3, and the lower right number 4. And then you start counting from the sagittal midline to the distal direction, okay? So this would be number 1 because of the quadrant, and 1 because it's the first tooth, central incisor, okay? So this would be the 1, 1, 1, 2, 1, 3, 1, 4, okay, until we find the 1, 8, right? So the upper right third molar. Then for the left sides, the upper left, this would be the quadrant 2. So now we have 2, 1, for the central incisor, okay, the upper left central incisor, and you keep counting towards distal side. So 2, 1, 2, 2, 2, 3, until you find the 2, 8, okay, the upper left third molar. And then you'd have the lower left third molar being the 3, 8, of course, following the same system, right? So 3, 1, 3, 2, 3, 3, 3, 4, until you find the 3, 8. And of course, the lower right would be the 4 quadrant, so 4, 1, 4, 2, 4, 3, until we find the 4, 8. The lower right third molar. So what is this tooth, for example? Okay, the lower left first molar, okay, and of course this would be the 3, 6, right? So this is a matter of training. So of course you should adapt to the tooth numbers that you use in your course or in your clinical routine, and you should train this because it's very important. That's how we refer a case or how we communicate with other professionals regarding which tooth we are talking about. So this would be the main terminology. If you guys like, please hit the like button and see you guys on the next videos.